All right, welcome to today's webinar. The webinar today is called Dyadic Research in Older Adults Living with Chronic Conditions. This webinar is coordinated by the Aging Initiative, which is an NIA-funded initiative that bridges the expertise and leadership of two powerhouses for research on multiple chronic conditions: the Healthcare Systems Research Network and the Claude D. Older Americans Independent Centers, or Pepper Centers. The Aging Initiative is led by Dr. Jerry Gurwitz at UMass Chan Medical School, along with co-PIs Elise Adams and Jay Magaziner. My name is Heather Whitson. I'm a professor of medicine at Duke University, and I co-lead the Aging Initiative Career Development Core with Dr. Leah Hanson, who is Director of Neuroscience Research and a Senior Researcher at HealthPartners. Due to the number of registrants for today's webinar, we have placed phone lines on mute to reduce audio feedback. However, we welcome and encourage audience participation using the chat function. If you have technical or logistical questions, we ask that you submit those in the chat to Ollie DeRochers, a research coordinator at UMass Chan who supports the Aging Initiative. And now I'm going to introduce today's speakers. We will first hear from Dr. Courtney Polenick. She is an assistant professor in the Department of Psychiatry and a faculty associate in Aging and Biopsychosocial Innovations Program of Survey Research Center at the Institute for Social Research at the University of Michigan. Dr. Polenick's research focuses on family relationships and caregiving in the context of complex care needs, including dementia and multimorbidity. She's particularly interested in understanding family influences in everyday life that inform strategies to improve the well-being of people who are living with chronic conditions and their care partners. We will then be joined by two discussants. Dr. Evan Plys is a board-certified geropsychologist at the Center for Health Outcomes and Interdisciplinary Research at Massachusetts General Hospital and a faculty member in the Department of Psychiatry at Harvard Medical School. His current research focuses on dyadic interventions to reduce emotional distress among older adults and their care partners during subacute rehabilitation stays in skilled nursing facilities. He's an alumnus of the Aging Initiative MCC Scholars Program. We are also joined by Maria Pellerano, who is an MA, MBA, and MPH, and a member of the Aging Initiative Patient Caregiver Advisory Council, APCA. Maria Pellerano is involved with PCORI as an ambassador and as a grant reviewer. She is also assistant professor in the Department of Family Medicine and Community Health at Rutgers Robert Wood Johnson Medical School. There, she assists academic colleagues with research projects that engage patients and families from low-income, minority, or low-literacy populations in patient-centered outcomes research. Without further ado, I'm going to turn it over to our presenters. Thanks.
Okay, thanks so much, everyone. So I'm Dr. Courtney Polenick, and I'm really excited to talk with all of you today about dyadic research in older adults living with chronic conditions. My apologies that my video is not working today. There's always something unexpected with Zoom, but I'm glad that I'm able to join you. So as all of us know, chronic conditions are very, very common in the United States. So we know that about 1 in 3 adults age 18 and older live with at least one chronic condition. And nearly half of adults age 18 and older live with 2 or more chronic conditions. So it's really important to think about how people are managing multiple chronic conditions and what are the contexts that are really important to consider in this management. And one way to think about managing multiple chronic conditions is described by the concordant-discordant model of comorbidities. So according to this model, concordant conditions have overlapping self-management strategies, whereas discordant conditions have little or no overlap in their self-management strategies. So again, this is thinking about managing 2 or more chronic conditions, and are they concordant in their management strategies or are they discordant in their management strategies? And just to illustrate this with an example, we know that concordance may make chronic disease management plans more synergistic or more simplified, whereas discordance may complicate disease management plans by increasing self-management burden. So if we think about a patient living with diabetes, that person is doing a number of things to manage their conditions, such as blood glucose monitoring, insulin management, and cardiovascular risk reduction activities, such as managing blood pressure. If that person also has heart disease, cardiovascular risk reduction is a major component of both of those conditions. So this would be considered a concordant pair of conditions. But if the person living with diabetes also has arthritis, the arthritis requires managing physical function, pain management, but those things really don't directly overlap with diabetes self-management. So we would consider those two conditions to be discordant conditions. So thinking about discordant conditions in a dyadic context, we know midlife and older adults living with chronic illness often have a spouse or a cohabiting partner who also lives with chronic conditions. So it's really important to think about chronic condition management during this time in a dyadic context. And when we think about this, my colleagues and I have thought about discordance in terms of individual level discordance. So just as we talked about, maybe a wife in a couple has both diabetes and arthritis, which require discordant strategies for self-management. We can also think of discordance dyadically in terms of couple level discordance. So for example, a wife in a couple might have diabetes and her husband may have arthritis, and the discordant self-management strategies within this couple may complicate their self-management. And so thinking about these issues dyadically, we've formed the dyadic concordance model of multimorbidity. So this is proposing that chronic condition discordance at both individual and couple levels has negative implications for self-management and well-being over time. And just to show you what this looks like in a model, so we know that chronic condition discordance, both at an individual level, has implications for self-management and well-being. But this model also proposes that over and above these effects, one's own chronic condition discordance is also impacting their partner's self-management and well-being. In addition, couple-level chronic condition discordance over and above each partner's individual level chronic condition discordance is hypothesized to have impacts on self-management and well-being in both partners of the couple. And we've measured this in a variety of ways. So first, we've thought about looking at discordant versus concordant conditions within dyads. So discordant chronic conditions within couples are measured as a presence of two or more discordant conditions within individuals, so at the individual level, and also the presence of two or more discordant conditions between partners, so thinking about the couple level. And the identification of discordant conditions is based on previous research. We created these variables in our research using data on 7 major chronic conditions from the Health and Retirement Study that have an important impact on functioning and mortality. So these are arthritis, cancer, diabetes, heart disease, hypertension, lung disease, and stroke. So this table shows you in our research what conditions were considered to be concordant. So you have conditions that include diabetes and heart disease, hypertension, and stroke. So all the various combinations of these conditions are considered to be concordant because they all have a focus on lowering cardiovascular risk. Then this table is showing the conditions that we categorized as discordant based on previous research. So these are combinations of conditions including arthritis, cancer, and lung disease. And again, these conditions are considered to be discordant because they involve self-management strategies that aren't directly overlapping. So looking now at some key findings from the Health and Retirement Study, we've used longitudinal HRS data to examine how the presence of discordant conditions within couples is linked to health and well-being over time. And first, we wanted to know, is the presence of one or more discordant conditions within individuals or between spouses, so again, the between partners is getting at the couple level discordance, is that associated with higher levels of depressive symptoms and functional disability over time? So we found in one of our papers examining discordant chronic conditions and depressive symptoms that wives and husbands reported significantly greater depressive symptoms when they had individual level discordant conditions about 2 years after baseline. And these links actually strengthened over time, which suggests that the consequences of managing discordant conditions actually have worse impacts with time. And we also found that husbands had significantly greater depressive symptoms when there were couple-level discordant conditions. And we think that this might partly be the case because within couples, wives tend to support both their own health and their partner's health, and husbands are relying more on their wives for managing chronic illness. So this might be why husbands are more impacted by couple-level discordance. We also looked at, in another paper, individual level and couple level discordant chronic conditions and how they're impacting functional disability within couples. And we found that wives and husbands had higher initial disability when they had their own discordant conditions at baseline, and also when there were couple level discordant conditions. We also found that husbands reported higher initial disability when their wives had discordant conditions. So again, this could be getting at potentially husbands are relying more on their wives to manage their conditions effectively. So when wives themselves have more complex conditions that they're managing, they may be less able to support their husband in managing his conditions. We also found that wives have a slower rate of increase in disability when there were couple-level discordant conditions. And this could be potentially because wives are providing more caregiving, which actually could provide some physical health benefits in that they're more physically active. And this could actually prevent, to some extent, increases in disability over time. We've also looked at measuring chronic condition discordance in terms of the degree of chronic condition discordance within dyads. So we looked at this as the extent to which 2 or more pairs of chronic conditions within individuals at the individual level and between partners at the partner level are rated as concordant in their treatment goals and self-management strategies. So we created these variables again using data on the 7 major chronic conditions from the Health and Retirement Study: arthritis, cancer, diabetes, heart disease, hypertension, lung disease, and stroke. And we had 12 board-certified geriatricians rate their perceptions of the degree to which each of 21 possible chronic condition pairs are concordant on a 5-point scale. Overall, the raters had excellent inter-rater reliability. And we reverse coded these scores and averaged the mean scores for discordance within individuals and between partners or couple level discordance. So again, the individual level discordance is getting at average mean scores for all conditions that are within individuals. And the couple level discordance scores measuring average mean scores for all condition pairs that are occurring between partners. And this table is showing the degree of discordance that we found in the data. So you can see that cancer and hypertension has the highest discordant score of 4.5, whereas the lowest discordant score is heart disease and hypertension at 1.3. So what these scores are showing, just as a reminder, so cancer and hypertension was reported to be the most discordant pair of conditions. So this would mean that they have the least overlap or similarity in their self-management strategies, whereas heart disease and hypertension was rated as the most concordant in that they have the most similarities or synergies in self-management. So looking at some key findings using this degree of discordance variable in the Health and Retirement Study, we use longitudinal HRS data to examine how the degrees of discordance within couples are linked to health and well-being over time. And we wanted to know, do the greater degrees of discordance within couples are they linked to lower levels of physical activity and perceived control within couples over time? And so our paper examined this issue, and we found that when individuals or their partners had greater individual level chronic condition discordance, so more discordance again means less overlap in self-management strategies, they actually reported lower initial moderate physical activity. So this suggests that when individuals or their partners have more complex conditions that they themselves are managing, they each actually report less physical activity, possibly because there's more self-management burden, and so they're less physically active. We also found that husbands had greater individual level discordance. And when this happened, both wives and husbands had a faster rate of decline in moderate physical activity over time. And this could possibly be because when husbands are managing more complex conditions, their wives might be providing more assistance to them, and this ultimately over time could lead to less engagement in physical activity. We also looked at another paper that considered longitudinal associations between chronic condition discordance and perceived control among older couples. And some of the key findings from this study, we found that when wives had greater discordance in their own chronic conditions, they reported lower initial levels of personal mastery. So this could be related to just feeling overwhelmed by greater self-management burden, and this could actually impact their feelings of mastery overall. We also found that when husbands had greater discordance in their own chronic conditions, they reported lower initial health-related control, as well as faster declines in health-related control and personal mastery. And we also found that their wives reported faster declines in personal mastery. So this suggests that chronic condition discordance in husbands may have particularly strong impacts on feelings of control, both related to health and also overall personal mastery within the couple. And again, this very likely could be because when husbands have more challenging conditions, wives are stepping in more to provide caregiving. And over time, this could be detrimental to both partners' feelings of control over their health and overall mastery. We also found that when there was greater couple-level discordance, wives reported lower initial health-related control. And this, again, might be getting at the idea that wives are providing more caregiving. They're, doing more in cases where there's discordance within the couple. What they're doing to manage their conditions isn't really aligning with what they need to do to help their husband. So this could have detrimental effects on their own health-related control. So another way that we've recently thought about thinking about the discordance and concordance conceptualization within dyads in relation to managing chronic conditions is thinking about perceptions of similarities and differences in self-management strategies that are actually, coming from couples. So perceptions of chronic condition concordance and discordance could be assessed through open-ended questions about similar and different self-management strategies. So we've thought about this as well in our research. And I'll talk a little bit about some key findings from the Self-Management, Health, and Resilience in Partners study, or the SHARP study. This study included a total of 56 heterosexual couples in which both partners lived with 2 or more chronic conditions, and at least one of these partners was age 50 or older. In this study, both partners had at least one condition that required daily self-management, and these included arthritis, cancer, COPD, chronic heart failure, coronary artery disease, heart disease or ischemic heart disease, diabetes, or TIA. And we also had both partners in the couple complete 45 to 60-minute recorded phone interviews, which included semi-structured questions about their individual management and joint management of chronic conditions. And in these interviews, we asked about concordance and discordance in these management strategies. So First, we asked, are there similar things that you do to manage 2 or more of your conditions? And some probes to encourage elaborations included, what do you do that is similar? In what ways do those similar things make it easier or harder to manage your conditions? And I'll share some of the preliminary findings from some of these questions. So one wife told us they were all kind of intertwined. I mean, my lupus, my fibromyalgia, arthritis, obviously all benefit from exercise, particularly the swimming. Walking the dog, I get fresh air, and again, I'm getting some exercise with brisk walk. I think a healthy diet is good for everybody. So this example shows what we found quite frequently in the data, which is that people often identify physical activity and things like a healthy diet as being beneficial in managing many of their conditions. A husband told us, yes, the things that I do that are similar are proper diet, daily exercise, good sleep hygiene, and ensuring that I talk with my wife and express concerns and worries with her. And those are similar to all the problems that I have. That results in being able to keep my weight at an appropriate level with a BMI less than 25 and helps with my mental health outlook. So this response, again, really illustrates that people do identify that there are some similar things that they are doing. Again, this participant mentioned sleep as well, in addition to exercise and diet. And also this response, kind of brings to light the importance of communication and expressing concerns or worries about, managing conditions or trying to do things, to manage things, in a more synergistic way. So that was also something we saw quite a bit in the data. We also asked both partners, are there things you do to manage one condition that aren't as useful for or get in the way of managing other conditions? And some probes to encourage elaboration included, can you tell me more and how does this affect you? So wife told us a lot of the things that I used to do for the arthritis, like the walking and the stretching and the things that make exacerbate the spinal stenosis, and the exercise that I used to do to maintain my weight are impossible because of the spinal stenosis. It makes me feel a little isolated because I used to go on these walks with my husband and now I can't. So I encourage him to continue walking because it's good for him too. And we thought this was an interesting example because it highlights that, one condition can make it really difficult to do the things that you need to do to manage another condition. So we know arthritis, it's really important to maintain physical activity, but the spinal stenosis that this wife was experiencing made that really painful and difficult. And she also mentioned that she has concerns because she used to go walking with her husband and she wants to make sure that he continues that even though she's not able to. So I think this really highlights how it's important to think about chronic illness management dyadically, in terms of how conditions are impacting the self-management of both partners. My husband told us I have some back problems also, and so I have to be careful not to overdo the shoulder because that affects the back and vice versa. Well, it affects you from the standpoint that you have to be constantly aware of what your body's telling you and don't neglect it, because I've learned over the years, if you do that, you get in trouble really quickly. So again, just really showing that people are aware that they have to kind of balance what they're able to do each day in terms of managing both conditions. And there are things that they can do to manage both, but they need to be aware of kind of problems or things that might be challenging. We also asked, are there similar things that you and your partner both do to manage your conditions? And asked some probes related to what do you and your partner both do that is similar, and in what ways are those things helpful or unhelpful? So this is getting at now couple level chronic conditions in terms of concordance of those conditions. So one wife told us we make sure everybody takes their medications. He'll ask me if I need something or anything like that, or if I need more inhalers or anything like that, or if I need my oxygen. He's always making sure we're all set, and I make sure he's got his meds. So that kind of shows that Medication management is very commonly mentioned as something that spouses see as similar in what they do as a couple to manage conditions. And often we see that both partners are helping each other just to make sure that they're taking their medications at the right time, in the correct dose, and just kind of checking on one another to make sure that they're managing well. A husband told us, well, I guess obviously would be take the medications, have the medications on hand. And the other thing is exercise. Before COVID, we were going to the gym probably 3 or 4 days a week, which really helped. I still ride bike once in a while, and we live in a small lake, so we swim quite a lot, but it's not like every day. So again, this example shows that couples, again, often take medication together. Exercise is another thing that came up quite frequently, that people are, using exercise as something that they do together as a couple. COVID did somewhat disrupt that a bit for some couples, but we did find that a lot of couples do work together to make sure that they're both exercising to manage their conditions. We also asked, are there things you do to manage your conditions that aren't as useful for or get in the way of managing your partner's conditions? So again, this is kind of getting at the discordance that might be occurring within couples. And probes included asking people, can you tell me more, and how does that affect you and your partner? So one wife told us, well, probably again, before my pump was upgraded and I had low blood sugar, that would probably raise his blood pressure because he would go into panic mode. So that wasn't probably good for his blood pressure, and I was in low blood sugar distress. So this is a good example of showing how, the management of one partner can have a negative impact on the self-management of the other partner in the couple. So this wife had difficulty with her blood sugar, and her husband would be very, very stressed about this. And that would negatively impact his blood pressure and other conditions that were cardiovascular that he was managing. So this is a really good example of just being aware of the stress that that partners experience sometimes in managing conditions and how that can affect both partners. Another wife told us I would eat a lot differently than we do. I would probably eat a more irregular diet according to how I feel like I need some food right now. And I have a much wider palate than he does. So I feel like a lot of our diet is still kind of geared toward his needs and wants for the most part. And this is another thing that we saw quite frequently, especially with diet. So often there would be one partner who had special dietary needs, but another did not. And sometimes that would cause some difficulties within the couple, and, just some different needs in terms of when they need to eat and what they need to eat. So that's another thing that was frequently mentioned as a challenge of discordant conditions. We also asked, are there things that your partner does to manage his or her conditions that aren't as useful for or get in the way of managing your own conditions? So again, this is kind of getting at what the partner might be doing that could be maybe not as helpful for your own conditions. And probes included, can you tell me more, and how does that affect you and your partner? So a husband told us, yeah, I think there is. She takes time for herself. I know that when I'm on the machine, I give her her time, I guess is the best way to put it. So she can do what she has to do or her stuff that she has to. I try not to interrupt her so she can better do what she has to do. So this example, we think, shows that the husband in the couple is aware that sometimes there's, not a lot of alignment with what he has to do and what his wife has to do. So I think this shows that, there is often an awareness of that, and partners can use some strategies to try to work around and give their partner some time to do what they need to do that might be different in terms of self-management. Another husband told us, I wish she would do more. And that does that get in my way? I can't let it get in my way. If she doesn't want to go on a walk, I don't make her go on a walk, but I go on the walk. I don't not do it because she won't do it. So I don't let her obstruction of to her own health obstruct me from doing what I can do to improve my own health. I don't like it, but that's what I have to do. So this, I think, is an interesting example of discordance, and that this husband is realizing that sometimes his wife, doesn't want to go for a walk, or it's difficult for her to go for a walk, but he makes sure to kind of work around that by making sure that he does still go walk, even though he would like her to do different things with her own self-management. He's able to make sure that he's doing what he needs to do to take care of his own health. So thinking about all of these current findings, overall findings suggest that chronic condition discordance within dyads has negative implications overall for health and well-being over time. And we found that the presence of discordant conditions, so having discordant conditions and the degree of discordant conditions at individual levels and couple levels, are both associated with worse health behaviors and poor well-being within couples. We've also found that couples perceive similar strategies that support their management of chronic conditions, again, occurring at both the individual level and the couple level. And they also see different strategies that make management more complex, both within each partner's own conditions and in the conditions that they each manage. Thinking about future directions, it's really important to think about how a better understanding of how chronic condition discordance within dyads is associated with health and well-being over time. And to do that, we really need to learn more about more diverse types of couples. So the couples in our current research are all heterosexual couples. So we need to know more about same-sex couples and couples who aren't living together, and how things might be different or similar across different types of couples. We also definitely need to know more about other types of dyads. So for example, another important dyad in later life would be adult children and their older parents, especially as adult children are moving into more of a role where they're supporting their parents and managing chronic conditions. But we know at midlife, people are also starting to experience their own chronic conditions. So I think thinking about how adult children are navigating both the onset of their own conditions, but also helping their parents would be really important to consider. And then also there may be other ways, certainly, to think about managing chronic condition discordance, both within individuals and within dyads. So I think thinking more about this construct and ways to capture it and measure it is really important moving forward. And that's all I have for today. And I'd like to acknowledge my grants that supported this research from the National Institute on Aging. I really appreciate your time today, and feel free to ask any questions and contact me if you have additional questions after the session.
Well, thank you so much, Dr. Polenick, for an excellent presentation. We'll now open the discussion to questions for the speaker. Please feel free to use the Q&A function, and we will moderate that chat. And while we wait for questions to come in, we'll begin by hearing from our discussants, Dr. Plys and Maria Pellerano.
I can get us started. Thank you, Dr. Polenick, for that amazing presentation. And I do just want to highlight this dyadic work is so hard to do. Like this research is so complicated. You think about even participation rates as a researcher. If you get like 30% of folks participating in your study, that's a really good number. Then you have to double that for the dyad, and the complexity of taking responses and comparing them to the other member of the dyad. This work is not easy, and Dr. Polenick has just done such an amazing job with that. I think also this work is a really compelling evidence for the benefit of dyadic interventions. Some of the factors that we're talking about here around perceived mastery and control, health behavior change, communication, these are modifiable with non-pharmacological intervention. And so I think that's a a really important area to invest in, not just to develop efficacy of these interventions, but also comparative effectiveness and with individual interventions, and then down the line, implementation, which I think is an uphill battle to kind of go against this individual intervention framework that we currently have. The other thing I wanted to mention before handing it over is just the importance of mental health. And I think, we talk about mental health as kind of a consequence of, the stress and, some of these challenging health behaviors. But I think we could also think about mental health as a chronic condition in and of itself. I think especially we're seeing folks with serious mental illness are living longer. We have higher rates of serious mental illness in the baby boomer generation. And so, I think this is a really valuable framework to also think about concordance and discordance in mental health conditions or substance use conditions for couples as they're aging.
Dr. Hanson, I didn't know if you wanted to go on to questions or you want me to respond.
Maria, we'd love to hear your thoughts.
Okay. Well, first of all, I'd really like to thank Dr. Polenick for even looking at caregivers. So little research has actually been done on caregiving on any level, and it's very interesting. I am a caregiver. I have been a caregiver of elderly relatives. I am also now in one of these dyadic couples. I myself am I'm certainly over 50, I can tell you that. And my husband is also as well, and he is actually 19 years older than I am. So we both have chronic conditions, and we have managed to find concordance. But I think for me, what I'm really interested in seeing and how this research goes is future work is in interventions for couples, and how does it help couples rethink about when they have discordant conditions and they're struggling to make the things that might help them, like physical activity and diet, work for each other, how to better do that. And I'm always on that end of the world, is like, how do we fix things and how do we make it better for people? But I do want to thank you very much for even starting the conversation. And I appreciate that you're thinking about doing, I have to tell you, it was much more challenging for me as a caregiver to caregive for my mother than it is for me to with my husband. And I don't know if that's because we've lived together so long, my husband and I have lived together so long, or whether it is that the generational piece between my mother and I, we were easily separated by almost 1.5 generations, my mother and I, in age. And she had ideas and I had ideas, and they didn't always work together. So as you move forward, you might want to explore sort of the why people feel they experience these things. And I love also that you're doing some qualitative work, because not too many people do the qualitative work. I am a qualitative researcher by training, so I tend to lean that way, but I really appreciate that work.
Courtney, do you want to respond to Maria's thoughts?
Yeah, so these are all, thank you so much. These are all really important considerations. And I think, especially in thinking about how you mentioned, like with really thinking about the family relationships and kind of the dynamics of, maybe adult-child parent relationships versus couple relationships, I think that's so important to consider moving forward, especially in terms of thinking about interventions and what would be things that we'd want to make sure to help people navigate. What are the possible challenges of different types of close relationships? So I think all of those things are really, really important, and definitely something that we'll want to look at moving forward.
And one other thing which I forgot to mention, and I just looked at my notes, is demographic differences across couples. So I'm talking mostly about race and ethnicity. So we know that healthcare has treated people of color differently than they have treated white. So I've been privileged being a white person taking care of white people that in my healthcare in many cases. But how does that affect the dyadic relationship, and are there differences across those kinds of demographics?
Yeah, absolutely. Well, there's certainly different challenges faced by different demographics, different resources. Yeah, so absolutely. I think that's something that will also absolutely need to be taken into account when we think about what are the best strategies and ways to approach dyads. Thank you. These are really great comments.
I'm wondering, can you address Evan's point about just the difficulty in conducting this type of research? What were some of the barriers that you maybe faced in doing this work, or facilitators in your recruitment?
Yeah, so I'd say certainly, as Evan mentioned, the main challenge is just that you have to get both partners to agree to participate, and that can be often a bit of a challenge. We'll very frequently have one partner that wants to, but then they say that their partner decided not to, or doesn't want to participate. So I think one challenge is certainly finding dyads where both people want to do the research. I would say just really being as broad as possible with your recruitment strategies, really thinking about ways to reach dyads. Support groups sometimes are great places to start. But yeah, I'd say that there's definitely a challenge, and it just requires a bit more resources to make sure that you're really, getting out there and finding people who would be interested in participating.
So we do have a few questions from the audience. Someone is asking, can you speak a little more about the same-sex couples? I know you mentioned that as sort of a future direction. How might you see that being part of a future study, or what knowledge has been generated from the literature of how things might be different in that population?
Yeah. So I think it would be really interesting to look at kind of within groups in particular in depth, like how are same-sex couples different. I think just from my understanding of the literature is I might expect that there could be a little bit more mutual support in same-sex couples. So maybe a little bit less where, like in heterosexual older couples, we often see the wife is kind of providing more support to their husband in addition to managing their own condition. So I would think that there might be a bit more mutual support within same-sex couples, but I think absolutely a great next step would be to look at, kind of like a really in-depth in-group and within-group analysis of same-sex couples to understand, how are the dynamics, similar or different to what we're seeing in heterosexual couples. It's a great question.
And Rachel, she comments, such great research. She is interested in exploring how the concordance-discordance correlations may be able to be used in a way to predict which couples may need more or less support.
Mm-hmm.
Have you thought of doing that?
Yeah. So basically, if I'm understanding the question, so kind of finding ways to use these scores to predict who might be in most need of intervention.
Yeah.
Yeah, I think absolutely. I think our research kind of speaks to that, like where we're seeing that couples are experiencing more depression over time, if we're seeing more discordant conditions or greater degree of discordance. So I absolutely think that it would be great to examine further, does this help us to identify people and couples who are in greater need of intervention? I think that's very important.
Another question is asking about, have you taken a look at how dementia and its comorbid conditions are managed or dealt with differently by couples from non-dementia comorbidities?
Yes, actually, we are in the process of looking at just that. So I'm not able to speak on that in too great of detail, but we absolutely are thinking about that, just kind of thinking broadly about it. We know that living with dementia, people often, face distinct challenges. So they may forget to take their medication or do other things that they need to do to manage their other chronic health conditions. So I think absolutely there are special considerations where there are couples where one partner is living with dementia. Generally, what we're seeing in our research is that that the dementia kind of overshadows other conditions and kind of takes more of the focus. So that can have detrimental impacts on both the person living with dementia and managing their other conditions, but then also on their spouse, because the spouse is often, kind of putting their own health needs on the back burner to care for their partner. But yeah, very, very exciting area. And I'm looking forward to working more in it.
Thank you. And we'll look forward to hearing an update from you when that work is done. We have another attendee is wondering how access or lack of access to social drivers of health impacts the experience of managing illness in a couple.
Yeah, interesting. So lack of access. Yeah, so I would say just in general, if there's a lack of resources, that's absolutely going to be challenging. So like for example, if there's a lack of social support, that's going to affect both members of the couple. If there's financial impacts, that's going to be another source of strain and also, probably negatively impacting access to care. So I would say that absolutely adds a layer of complexity. If there's a lack of access to resources or a lack of social support that either partner is experiencing, I think that's going to have impacts on the couple as a whole as well.
And we have another question that asks, when or in what scenarios do you think couples with discordant chronic conditions need the most support?
Yeah, that's a really great question. I would say they would need the most support, perhaps if they're not really able to kind of see possible synergies in what they could do to manage their conditions. So for example, when we asked this in our qualitative research, couples, that had very discordant conditions, kind of both within themselves and also, between partner discordance, very often they did mention that they exercise together or they, make sure that they're both eating a healthy diet. So I think, perhaps couples that aren't maybe seeing those similarities that they might be able to tap into to help one another just maintain their overall health and manage what are, possibly discordant conditions and more generally. I think just kind of helping those couples to maybe see ways that they can help one another and, do some things together to help manage conditions would be helpful.
Well, thank you so much. It looks like we're out of questions. Thank you again to Courtney and Evan and Maria for your presentations. We're really excited to hear about your work. For our audience, the recording for the webinar will be posted soon on the Aging Initiative website. As you sign off, you'll be prompted to complete a very brief survey regarding any thoughts or opinions you had about today's webinar. I ask that you take a brief moment to complete that. That really helps us continue to improve our webinars. Thanks to you all and have a great rest of your day.
Great. Thanks so much, everyone.